Hi everyone, welcome to Sage Talks Medicine. Today we'll be going over a physiology-based question, part of the neurology section of Step 1 USMLE. It is a question or a concept that I've seen multiple times, and it's an easy concept to master so that you'll get a guaranteed free point on your Step 1 USMLE. So let's just begin. The question is, a 32-year-old man is brought to the emergency department after a motor vehicle collision. He's unconscious with a Glasgow coma scale of 6, and a CT scan shows evidence of cerebral edema with signs of increased intracranial pressure. While preparing for surgical intervention, the patient is mechanically ventilated. Which of the following ventilation settings would help acutely reduce his intracranial pressure? So if you like to answer the question on your own, you can pause the video here and come back when you're ready. So what is the correct answer? It is B, increased respiration rate. So let's go over why B is the correct answer. Now, this is talking about cerebral perfusion, or the amount of blood that comes to your brain, and the main determining factor is the partial pressure of carbon dioxide, or CO2, and oxygen is a smaller determining factor, but only in cases of severe hypoxia. If the partial pressure of oxygen is less than 50 millimeter mercury. Also, other factors that determine the cerebral perfusion is blood pressure and intracranial pressure. And low blood pressure or high intracranial pressure means there's less blood coming to the brain. Now, there's a thing called therapeutic hyperventilation. Okay, this is a treatment that can treat acute cerebral edema that is unresponsive to other methods. So we know that CO2 is a vasodilator, right? So when we hyperventilate, when we're breathing in out really frequently, we're getting rid of the carbon dioxide. That would reduce the partial pressure of CO2. That would lead to vasoconstriction in our brain, and that would reduce the blood that's coming back into the brain, or reduce the cerebral blood flow, and that would overall reduce the intracranial pressure. So part of the USMLE Step 1 on first aid talks about this equation. So cerebral blood flow, right? That's the pressure gradient that drives the oxygen rich into the into the brain. That equals to the mean arterial pressure, or the blood pressure, minus the intracranial pressure. The intracranial pressure is whatever's inside the skull, so that can be due to the tissue, the CSF, and the blood. And this can increase due to trauma, tumor, hemorrhage, okay? And so I have this analogy right here. You have this blood that's coming back to the brain. Now, mean arterial pressure is the pressure in the garden hose, and intracranial pressure is, let's say, if we're stepping on the hose and it prevents the flow of blood, right? If you're stepping on it too hard, then less blood is coming back to the brain. Okay, so there's a delicate balance between intracranial pressure as well as mean arterial pressure. So cerebral perfusion pressure can be 0, and that would lead to brain death because, again, you're not getting enough oxygen. And we know that cerebral perfusion pressure is almost equivalent to the partial pressure of CO2 until a certain amount, and that is when the partial pressure of CO2 is more than 90 millimeters mercury. Okay, so the more pressure we have, the less cerebral perfusion pressure. So pretty simple, right, if it makes sense. So remember, anytime we want to reduce intracranial pressure, we're going to increase this respiration rate, and that's going to decrease PCO2, that's going to vasoconstrict, and that's going to reduce the intracranial pressure. Check. Okay, so why are the other options wrong? Let's go over them. So, increase the tidal volume. Why is that wrong? Well, increase the tidal volume, so that will increase the minute ventilation. So that will also reduce the partial pressure of CO2. But when you increase the tidal volume, like very high amount, that is not a first line treatment option because it's not generally not safe, because it could introduce barotrauma or volutrauma. So even though it would technically reduce the partial pressure of CO2, it is not safe, right? It can introduce barotrauma. So generally we would like to increase the respiration rate. Now, why is C incorrect? Decrease the respiration rate, it's the complete opposite of B. Again, if we decrease respiration rate, we'd increase the carbon dioxide that's in the body. That would lead to vasodilation, and that would just remember the garden hose analogy is you're going to be stepping on the garden hose harder, so it's going to increase the intracranial pressure, right? It's going to take up more space and increase the blood flow. And then D is increase the fractional oxygen, FiO2. It will increase oxygenation, but it doesn't really impact the cerebral vessel tone. And then administer bicarb. Well, that's not really helpful, even though it can help buffer acidosis. It's not really it doesn't really affect the vessel tone as much as the other option, the correct option. In fact, it might even increase the CO2 levels, which will again vasodilate, increase the intracranial pressure. So I hope this was helpful. This was a fairly short video, but again, it's a very simple concept and it's a easy point if you understand this on your test. I hope you all had a wonderful day and happy studying.